May or may not know this, but September is Pain Awareness Month. According to Axis Pain Center, each year over 100 million Americans struggle to enjoy activities because they're dealing with some sort of pain. Dr. Vijay Tillanathan joins me to talk about keeping all that pain away, hopefully, right? So you can have a better life. So tell me about the definition. What exactly is the definition of chronic pain?
So according to the International Association for the Study of Pain, they define chronic pain as any unpleasant sensory or emotional experience that someone is experiencing for greater than 3 months. And typically this type of pain limits their ability to perform what we call activities of daily living, such as getting dressed in the morning, taking care of themselves, eating, and taking care of their families. So that's a whole kind of general definition of it.
And I couldn't imagine just having that type of pain where you can't even do daily activities, right?
Correct.
And you said that there were 2 types.
Correct.
There are 2 types of chronic pain that really affect most Americans.
Correct. So neck and lower back pain are the most common things that we see on a day-to-day basis. Just pain in general, over 100 million Americans suffer from chronic pain itself, and when we talk about the prevalence and how it affects us, about over $635 billion per year are spent on lost in productivity and wages, as well as spent on medical care itself. So definitely a very prevalent thing. Within our practice, neck and lower back pain are the most common things that we do experience and see.
And we actually have a model here of the lower back, right?
Correct.
And that's where pain is normally found.
Correct.
That you see in your patients.
Correct.
So kind of demonstrate where exactly this pain occurs.
So probably one of the most common things that we see and people talk about is sciatic pain, a pain that starts in their back and travels all the way down their legs. So if this is our lower back here, this is where the head would be up here, and this is the very bottom portion. This is the back of the spine, and this is the front side. The blue that you see in the middle, that runs all the way down, that's the spinal cord. And you see these nerves coming off here. Those run all the way down to the legs. So typically the pain can originate from either the disc or the joints themselves that can contribute to this pain.
Wow. And you have to obviously go to a doctor to be treated for anything like this. So what do you suggest when it comes to treatment?
Correct. So normally you want to start with the things, conservative things that are easy to do at home, such as walking, exercise, taking care of your diet and health and things like that. Once those things aren't helping and the pain is continuing to persist, there's other treatment options such as injections or other things to try to help alleviate some of the pain that's being caused by either a disc or a nerve that's being irritated.
And when it comes to your patients, do you suggest, obviously you just suggested movement, even though you know a lot of them complain about being able to move.
Right. So walking is the best thing that a person can do to get rid of some of their lower back pain. It's when you stop moving, that's when the pain gets worse and it makes it harder to function and do what you need to do. So I encourage everybody to walk, even if it's 10-15 minutes a day, put a pair of sneakers on, go for a walk. It's the best thing somebody can do for their lower back.
Well, thank you, Dr. V, for all of that encouragement right there. And for more information, you can visit AxisPainCenter.com. Stay